Okay, I think we're live, Maria. So welcome everyone to Telehealth Tuesday. We're going to wait while everyone jumps on. So please let us know where you are all located, and we would love to do a shout out. So it looks like we'll just wait a couple of minutes, Maria, just for everyone to jump on.
Sure.
And yeah. So how's your morning been, Maria?
Busy, which is good. How about you? How are things over there?
Yes, very good here in Australia. Just it's been a bit of a rainy morning, so yeah, good timing to do a Telehealth Tuesday.
Absolutely. I heard floods. Are you okay from the floods?
Yes, yeah, absolutely. We're okay, but there are some communities that have been affected. So yeah.
2021 starting out to be another crazy year, which is all kinds of.
I know. So we are going to run a competition today as well. So if you like our page, comment and share our video, we will put you in the draw to win a telescope system. So I will get started. Maria, we have the fabulous Dr. Maria Kunstadter. Hopefully I pronounced that correctly, Maria. Yes, so I'm delighted to welcome you today. I just wanted to start with a little story on how I first met Maria. And it was through Mark Ackerman. And basically we had our first advisory meeting for the American Tele Dentistry Association. And Maria was a powerhouse on the call. And I thought, I have to know this lady. She is amazing. And then I started looking up your background and I thought, oh my gosh, she's an innovator. She's a creator. And I'm very excited to have you with us today. So a little bit later, we'll talk about how we came together and decided to partner together for, virtual dental care. But for the moment, I'd love to hand over to you so that you can tell us a little bit about your journey into teledentistry.
I'd be delighted to. Well, I am a dentist. I define myself as a mom, a grandmother, a wife, a dentist, an entrepreneur, and the owner of a telehealth company. So I have many hats to wear, and I love it all. I love the opportunity to be able to do all that. So as a dentist, I had a great practice and was busy working away, and I was invited to be the dental director of what's called the Pains Alliance of Kansas City, which was addressing the opioid crisis back in 2012, 2013. And I was, obviously there's a lot of dental pain that's chronic pain, and the people with suffering from chronic pain were having problems because they couldn't get their opioids. So we were in Washington, D.C. at all these big meetings with a lot of organizations, and I was the only dentist, but I kept hearing over and over again from the podium that people go to the emergency room for pain, which is yes, but in the top 10 reasons, over and over again, the speaker said that people go to emergency rooms for toothaches. And it was just like, well, that's just crazy. There's no dentist in the emergency room. They don't get any care. And then the American Dental Association came out in 2014 and said 2.2 billion healthcare dollars spent in the emergency rooms on toothache codes in 1 year. And back in DC, after that report came out, I was sitting at a table on, again, another conference with, I say, really smart people, and they were physicians already doing telemedicine. And I say it was a perfect storm of sitting there. It just washed over me. That's what we need. We need virtual dentists in emergency rooms to answer the call when an emergency patient comes in with a toothache. And that was the start of teledentistry. Currently, the ADA says that every 15 seconds someone goes into emergency room in the United States with a toothache. And that is what we're trying to help divert patients and get them to the right specialist, and do a telehealth consult instead of spending thousands of dollars waiting hours and hours and sitting in an emergency room. And all they're ever told is, here's some medicine, not narcotics anymore, go find a dentist. So our goal with with doing ER diversion was to be the right specialist for the patient. They'd see a dentist if they had a dental problem. triage them and palliate them for what they needed to have done, and then we actually appoint our patients into a brick and mortar dental office if they need hands-on care for further care. So disrupted the ER scene, disrupted the patients not knowing where to go or what to do because they didn't have a dentist. And again, and so we were working on this big project. We were the first teledental platform developed for dental consults. And we
what
were
year was that, Maria? Sorry to interrupt, but what year? When was that? That was.
We started in 2014, actually,
Wow.
and we had to develop our own dental platform, teledental platform, because there wasn't any out there. We went to the American Telemedicine Association meeting and learned a lot about how to set up and be a telehealth company, because of course dentistry is a subspecialty of medicine. So we were, we built it on a telemedicine type of platform. And then, we did research and development, all kinds of things over a couple of years. And then COVID hit. And when COVID hit last year, suddenly people were coming to us and saying, we need you to provide teledentistry for our members. We had big insurance companies come to us. Big companies say we want to do teledentistry, and we were ready, we were equipped, we were trained, we had hundreds of dentists that we could take the call, and I say we were like the National Guard of teledentistry. The COVID war came, we literally turned a switch and our team went to work and did a great job, and here we are today with a really booming industry that was not even heard of in 2014.
Absolutely. So you foresaw what was going to happen, I believe, Maria. Like, 2014, I don't think there was much talk about teledentistry. So you must be pretty, excited and proud that you actually, saw this coming about and something that needed to be changed in the industry, and you moved forward.
Well, I think it was, I'm not sure I was foresight. I knew this needed to be done because we needed people to have access. And now, again, the perfect storm. The technology was now available that people could talk, and physicians and dentists could see their patients on video consults. So the technology was available. The demand was now here, and that, everything sort of fit together saying, this is something that we need to give people access to an oral health specialist. And what I tell about COVID is the genie's out of the bottle. Everybody knows that they can sit at home and say, this tooth is killing me and I don't need to go to the emergency room. I'll just talk to the teledentist. And they're not, the genie's not going to go back in the bottle. During COVID, 180 million Americans did not see a dentist. So there's a huge market, untapped market of people that need consultation, need to know where to go, what to do, and how to take care of themselves. And that's what the teledentist does.
Yeah, that's fantastic. So, and that leads you on to the teledentistry platform and how it all works. Do you want to just let us know how you kind of started that build and that transition for people to use it?
Well, it is really just from, I was a dentist, practicing dentist for years, and I like nothing more. I love patients. And so it really is, we built it around, as you sit down beside your patient for the first time, you sit and talk to them about what's going on with them, what medications they're taking. You do a medical history and you review their medical history, and you kind of assess the patient in about 10 to 15 minutes, what's wrong, how their health is impacting that, and what you can do about it. And that's exactly what a consultation involves, except for it's done with a video consult, just like we're doing right now. Actually, this is how I talk to patients all day long when I talk to patients, is face-to-face. Patients love it because in our setting, there's no staff running behind them saying, doctor, you need to go to the other room. It's a really one-on-one visit. And that probably the only time a lot of people have ever gotten to speak to a healthcare professional with no interruptions and face-to-face. So what I talk about now with COVID is, you get your mask on, your shield on, your goggles on, your loupes on. And the first time a patient sees you, you're in all this spaceman gear. And the patients can't develop a confident relationship with somebody that the only thing they see is, their eye is barely peeking out behind their glasses. So this gives you also a chance to talk to people face to face, just like we're talking, and you get to get that trust and that the sincerity and the sincere exhibits that you really do care about what the patient's feeling and what their needs are. So it's a great opportunity now to be face to face with your patients.
Yeah, I see that. That's fantastic, I think, for, you know, people, particularly myself. I'm a mother of 4, so I know the struggles that we've gone through, you know, during 2020 and still in 2021 with being locked down and having children and wanting to have that face-to-face with a dentist or a doctor. So, you know, it's continuously happening all the time in our house. So, you know, as a female founder in the dental space, have you had a lot of challenges, Maria? And, you know, talk us through those and maybe some of those advantages as well that you've seen.
Well, this has been a very interesting walk because, again, when I started dental school, only 3% of practicing dentists were women. I was in a class of 160, and there were only 10 women in my class. And so it's been an interesting being in dentistry, a minority. When I go to dental meetings in the early on, people would look at me like, what's she doing here? And now that I am in technology, now I'm in another industry where it's very few women representation. In fact, when I go places, it's the Steve Jobs lookalike 25-year-old young men that are in their black turtlenecks and their black jeans. And they look at me like, what is she doing here? And indeed, it's I don't know how I always get myself into this, but currently only 4% of healthcare executives are female. You know, I keep saying in this 3 to 4%. And then when you talk about a big company like ours booming and we're needing funding, venture capitalists, only 2 to 3% of venture capital money is given to women-owned companies. So it has been a constant moving forward, armed with the knowledge and the experience that I have, that just kind of keeps you going against all odds, and really believe that I do care about people and I care passionately about improving oral health. And people are starting to hear the message again, so that it's been an interesting journey. And why I always get in that small percentage, I don't know, but I am.
Yeah, look, I completely agree. You know, being a female founder, it's very difficult on a lot of levels. But I think your passion for oral health, and you know, one of ours is oral cancer as well. That's really, you know, pushed me through, and working with so many great advisors like yourself, Maria. I think every day where you share that same passion for what you're doing, it really gets you through those challenges in the you know, business space. So yeah, tell us more about the Tele Dentistry platform, and yeah, let's tell everyone about how we partnered together. I think that's you know, a really fun story.
Well, it was again another perfect storm, because we're cloud-based. I tell everybody, if I have my phone with me, I have my office with me, and we, you know, anybody can access us from the cloud on any of their systems. But a lot of people and a lot of clinics and a lot of moms and a lot of other professionals want a clinical view of what's going on in the mouth. And when you and I connected, it's like you have the tools to be able to illuminate the mouth, take great pictures, but then you needed where to send them, and so we're the where to send them. So our dentists get these wonderful pictures of what's bothering the patient, or simply even if it's an assessment, what the condition of their oral mouth is and what they need to do about it. And then they can talk to the patient like we're talking, but they can actually see the intraoral pictures and make a good assessment and a good judgment and recommendations for the patient. So it was a perfect combination of the tools, the illumination, the photography, again, technologies there, and your platform where we could join to the dentists that are waiting for calls from patients to be able to help them from our side, and sort of the rest is history. I think that the two platforms together will get even greater access for care, a lot more public health access for education and screenings and that type of thing, because we can see better in the mouth with the telescope 24/7. So it's a very exciting venture that we've undertaken.
Absolutely. I actually had an email through from Dr. Richard Simpson. He is actually on the call from Alabama, and I've noticed him on here. So basically, over the weekend, I had an email, Maria, from Dr. Simpson, and he said he was watching a video that I had taken using telescope inside my mouth, and he picked up a cavity. So I'm based in Australia, and Dr. Simpson actually sent me an email. Oh, Jen, I'm not sure whether I should tell you this, but I did pick up a cavity in your tooth when I was watching one of your videos. So off to the dentist I went, and you know, it really highlighted the importance of how things can be picked up that maybe you're unaware of as well. And that's something that I like, because I had no pain, no nothing, and I was unaware of it. And you know, to be able to pick that up, you know, all the way from the US and me being based in Australia, I think is a true highlight of what our connection and our partnership, our tool and your software can actually do for everyone. So I wanted to share that story with you, because I think it really highlights
his bill. Why did he get his bill for the diagnosis? He
hasn't told me yet, Dr. Simpson. Hopefully.
Kidding.
No.
Well,
so that's
to add to that, one of the many areas we're going into are hospitals to screen patients before they have surgery, because if a patient's mouth is not in good oral health, and you put a tube down their mouth and shove bacteria down their throat, you know, the patient's compromised from the very beginning. And you're with the telescope, will now have good visual pictures of the condition of the mouth sent to a dentist prior to surgery. So if that patient needs care, even if it's just a cleaning, get that microfilm off the teeth so that the patient goes into surgery, goes into cancer treatment or any type of condition that is required medically with good oral health. And this hospital is engaging our products to screen patients so that their patients will enter into the you know, life-changing surgeries in better condition, and there'll be better outcomes by doing that. So it is a very exciting tool, just, you know, to be able to assess the mouth on somebody that really has a lot going on, and be able to refer them to someone to take care of them before they have all that work done.
Yeah, no, that's very important. I think, you know, being able to introduce that at that level within the emergency departments, and also, yeah, before the operation. So it's very exciting that we've been able to partner together, Maria, and actually bring this out for everyone to use in America. So, and, you know, I guess we can open up to any questions if anyone has any, and if we can also answer them at a later date as well. So I've just seen here Dr. Simpson has actually written no bill. So no, that's great. And I'm just seeing who else we have here. Oh, Megan is actually from Brisbane, Australia. So that's fantastic. Oh, Mark. The pre-surgical screening, so that's great. Hey, Mark. So basically, Maria, is there anything that you think of that people always ask you, I guess, you know, as an industry leader in the dental space, bringing out the amazing Tele Dentistry platform? What other questions do you think, you know, as a female founder, as a woman charging ahead in the dental industry, what other questions do you get asked that you'd love to share with us today?
Well, there's a lot of important things that I think together we'll be able to help accomplish, and one of them is just the integration of medical care and dental care. I mean, I think it's important for everyone to know that, you know, we all have heard that our oral health really impacts our medical condition, but, you know, now we have the technology available to have people assessed and triaged to somewhere for care. So, you know, my goal in life is, I like people. In fact, I love people, and I love to talk, in case you hadn't noticed that. But you know, I think that no one should go into healthcare unless you like people, and to be able to make an impact on people by improving their health and improving their oral health at the same time is a huge opportunity that, obviously, with technology, we can spread that mission and those words out, you know, more nationally, and we are going international as well. So the company's mission is to provide essential dental services 24/7, 365. And I think that, you know, anywhere a dentist is needed, whenever a dentist is needed, so that somebody at 2 in the morning doesn't have to get up and run. You know, we had one patient woman that wrote a review, and she said, I have 2 autistic children, and I woke up at 3 in the morning, and in order to get help, I was going to have to bundle the kids up and take them with me to the emergency room. So when you get, information like that and thank yous from patients that say, you saved me by me being able to talk to a dentist. We've gotten so many appreciative patients that say, I didn't know what I was going to do, and I Googled and found you, and the doctor was great. I feel so much better, and it takes so little. And in my practice, it's funny, I started this concept years ago, you're right, because my staff was told that if someone called our office whenever and said they were in pain, my office staff was not to ask how they were going to pay, what insurance they had, or anything. They were supposed to say, how soon can you get to the office?
Yeah.
And because it takes so little time, and if you're in an office, so little money to listen to the patient and help them feel better. And that's sort of the same thing we do with virtual care. So we also avoid we always tell people now, don't go viral. Don't go out to the emergency room to have your tooth looked at and bring home COVID.
No, that's right.
So we literally say, don't go viral this time. Stay at home. In the comfort of your own home. We've had dental phobics who have been terrified of going to the dentist, but they were in so much pain they contacted us. And she said, this is the first time I ever talked to a dentist that I wasn't breaking out in a cold sweat. And the wonderful thing that happened on that one is the dentist she spoke to said, go and go to a sedation dentist. You don't have to sweat bullets and be in a panic because you're going in. Know that you can go to a dentist that will put you to sleep to have your work done. So she Googled and found a sedation dentist to go to, and has had, nothing but wonderful things to say. She said, I walked into that office not afraid because they weren't going to do anything but take my blood pressure and do some assessment and talk to the dentist, and they were going to put me to sleep to have my work done. And she's so grateful that somebody used sedation dentistry word for her. So we have a wonderful team. We have 300 dentists nationwide. And before COVID, we were at about 150 dentists. And during COVID, when dental offices closed and dentists weren't sure they wanted to go back to their offices with all the PPE requirements, we had a lot of dentists that want to be teledentists, and we still do. And the group that we, interviewed, credential, and train are just a phenomenal group of professionals that are forward-thinking. They're providing virtual care for patients. And it takes some training and it takes some concept to realize that this does work. And I basically believe that about 25% of office visits can be handled virtually. Again, no transmission of viruses, convenient for the patient. And I think that we're going to see a whole big boom. It's estimated telemedicine is going to, is already booming. It's skyrocketing into the 200 billion market. I don't even know, but teledentistry is supposed to grow to almost $3 billion market in about 3 years' time. And I see that because we are a subspecialty of medicine. I mean, anything you see with telemedicine booming, teledentistry is right behind, a little bit behind, and catching up very quickly. So it's an exciting time to be in telehealth. We definitely feel we were a silver lining for COVID because our business benefited by being able to help people. And that was a really good feeling. And we've gotten so many God bless yous from our patients that I think I'm good to go for a while. But,
that's great.
It's mobile. Most people talk to us from their cell phones. They can do it on their cell phones. And people ask about the senior set, and they go, "Oh, it's the technology. Isn't it too much for the senior set?" I went, These seniors are FaceTiming their grandchildren. This is the most savvy group of seniors. We have a lot of people in their 60s, 70s, and 80s that contact us on their cell phone, on their desktop. And of course, the younger people use their phone, all day long. And I call a cell phone the new health tool for this decade, because you can basically get almost all your healthcare needs except surgery and a tooth extraction. But you can get all your essential healthcare needs on a cell phone, and almost, no matter what socioeconomic level people are at, they all have cell phones. So the fact that we're fully mobile and people can access us from their cell phones, from their laptops, makes it a really accessible specialty of medicine that we can help people.
Well, that's right. So teledentistry anywhere, anytime, and that's
Mhm.
the key, I think,
Mhm.
to, understanding it. And what do you think? I mean, you've touched on a little bit. Anand says here, what's next for teledentistry and telehealth, Maria? What do you think? What do you see in the future? You, had a vision for it back in 2014. Now looking, 5 years in the future, what do you see?
Well, I'm very excited about our 2021 platform, which is medical dental integration. And the American Academy of Family Practitioners and the Academy of Pediatrics has supported oral health as part of primary care. And the Surgeon General said oral health has to be part of primary care since the year 2000. And it has not taken on because nobody had a tool that made it easy for physicians to have access to an oral health specialist, but now they do. So on any computer in any medical office, if a patient hasn't seen a dentist for a year, they should have a dental consult, get referred, get recommendations. Diabetic patients, you cannot get your A1Cs under control with full, gingivitis in your mouth. That's an infection. So we are hoping this year to get into medical offices and be able to bring dentists into medical offices so that, again, before all this research was done before COVID, but before COVID, 108 million people saw their primary care doctor but did not see a dentist. And 28 million people saw a dentist but didn't see a primary care doctor. So we want that 108 million people to have the chance to have an oral health experience, fluoride varnish if they're the right age, education, and triaging to a dental home so we can get that 108 million people into a dentist and get care so they will really have a better medical outcome.
And you know what, with those 108 million people, it'll be interesting to see once we start doing what you're talking about, introducing more of a virtual dental care into those physician offices, how much that can be reduced by them actually then going to an emergency department for an untreated oral health concern that turns into something nasty. Absolutely. So that's where I see, that connection being so, vital for, as we move forward with teledentistry.
Well, studies do show, I mean, again, before COVID studies, that integrating oral health into primary care on that population they studied reduced their medical costs by 17%, while you're actually improving their oral health and their total health. So it's a win-win-win. We reduce medical costs because health is improved. And if we integrate the oral health into the medical program and make dentistry part of medicine again, into all the teams on the hospitals and all those, a dentist should be part of a medical team. And now virtually, they can be very easily. So that's the exciting thing of getting oral health specialists into the medical field as part of the subspecialists that patients need, and everybody knows it's impactful. So now they have a tool to be able to make that impact.
No, that's fantastic. Carla's just asked a question for you, Maria. How can the dental hygienist use your platform?
Good question. Another very exciting group we're working with is Procter & Gamble, and they are doing chats on product recommendations and with hygienists. We have a hygiene team. Good question. And they are, doing product recommendations. They will, if the patient asks a question that's, oh, you need to talk to a dentist about that, they triage them to the dental link. But recommendations how to brush floss. They have some huge and exciting programs, and we're doing 3 pilots with Procter & Gamble in May that's going to focus mostly on hygienists. Our director of operations, Leah Sigler, is a hygienist, and she is just rocking when she sits and talks with Procter & Gamble big groups. And a couple of them are hygienists, but again, talk about passionate about oral hygiene and getting people's oral health. And she's leading that charge to get hygienists involved and on our platform. So stay tuned. We probably will have an access for talk to a dentist, talk to a hygienist shortly. But
no, and that's great. Yeah, so and dental hygienists could use it to triage, Maria. Do you think patients as well, if they would like to, so they could capture the imagery, send it through your software, and then actually use that to connect with patients, maybe when the patient is at home, and things like that as well. So
the standard teledentistry, I told people way back when we started, the the start of teledentistry was that a hygienist would take a computer and a Nomad and some Profi paste and a little bit more and go to a school, and this was in California, and they started dental homes where they are much more liberal about hygiene supervision. And they would go to a school and they would do just that. They'd send the pictures to the dentist back at the office. They'd send the x-rays. They'd send, photos back to the office, and the dentist could, in the evening go, oh, this patient needs to come in. Oh, this patient's fine. And that, it was the standard of what teledentistry used to be before we started this. Now that is restricted not by teledentistry, but by the state laws of hygienists, and whether they could have to have a direct supervision with the dentist over, in the office or out of the office, status of hygiene supervision. So it is an option. I think it's still in 8 states only that they can do that now, but definitely think that as they change and expand laws on teledentistry, that getting access to oral health care would be wonderful if we could get hygienists out for the basic preliminaries and get people in that need work from those x-rays and photos. And again, that's the original concept, and it's still being done in the 8 states that allow hygienists to practice unsupervised.
Fantastic. Oh, that's great. I'm just going to see if we have any more questions here for you, Maria. Am I missing any? Can you see the comments coming through there, Maria?
No, the comments are not available on my site.
Oh, we've got Mark from Las Vegas, and we've got Mike from Tucson, Arizona, and okay. All right, fantastic. Well, Maria, thank you so much for joining us today for Telehealth Tuesday. And it's been a pleasure talking to you, and we love working with you. So we're very grateful to have a partnership with you and to be introducing virtual dental care around America. If you have any more questions, please comment. And again, if you, after this video is posted, if you like it, comment and also share it, you will go in the draw to win a Telehealth telescope system. Thank you for joining.
Thank you very much. I appreciate it. And please contact me if anybody has any questions. That's great too. Thanks a lot. Bye-bye now.
Bye.